Anatomy and Physiology, the Urinary System, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, the Urinary System, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of the human urinary system. Part 1. 1. What is the function of calcitriol? Calcitriol normalizes calcemia. 2. What is ultrafiltration? Ultrafiltration is the filtration that takes place from the blood to the nephron. 3. What is detrusor? Detrusor is the muscle layer of the bladder. 4. What is osmolarity? Osmolarity is the regulation of the total volume of water in the organism, as well as the total concentration of solute in water. 5. Explain tubular reabsorption. Tubular reabsorption consists of recovering what the body needs to keep. It transfers certain substances from the filtrate to the blood selectively. It takes place in the kidney tubules. Tubular reabsorption recuperates almost everything that has been filtered. All that is not reabsorbed forms urine. 6. Explain tubular secretion. Tubular secretion allows certain blood substances to pass selectively into the filtrate. Tubular secretion occurs over the entire length of the renal tubules and the renal collecting tubules. 7. What is creatinine? Creatinine is what is produced in the muscles by the degradation of creatine phosphate. 8. What is cystitis? Cystitis is the inflammation of the bladder. 9. What is the function of urochrome? Urochrome gives urine its normal yellow color. 10. What is bilirubinuria? Bilirubinuria is the presence of bile in the urine. It causes liver disease. 11. What are renal calculi? Renal calculi consist of the crystallization of uric acid salts and the presence of stones in the urine. Part 2. 1. What is pyuria? Pyuria is the presence of pus in the urine. This is a urinary tract infection. 2. What is glycosuria? Glycosuria is the presence of glucose in the urine. This is diabetes mellitus. 3. What is uremia? Uremia is toxicity due to kidney failure. 4. What is pyelonephritis? Pyelonephritis is the inflammation of the kidney. 5. What is diabetes insipidus? Diabetes insipidus is a disease due to the production of an excessive amount of urine due to the deficiency of the antidiuretic hormone, ADH. 6. What is the trigon of the bladder? The trigon of the bladder is the triangular region at the base of the bladder. 7. What is excretion? Excretion is the tubular secretion that takes place from the blood to the tubular fluid. 8. What are macular denser cells? Macular denser cells are chemoreceptors sensitive to decreased sodium concentration. 9. What is renin? Renin is a hormone secreted by the kidney. It is a catalyst. 10. What is the function of angiotensin II? Angiotensin II raises the blood pressure. 11. What is oliguria? Oliguria is an insufficient diuresis. This is a decrease in the amount of urine produced. Part 3. 1. What are ketones? Ketones are end products of fatty acid degradation during slimming. 2. What is anuria? Anuria is the total absence of urine production. 3. What is acetonuria? Acetonuria is the presence of ketone bodies in the urine. 4. What is cystitis? Cystitis is the inflammation of the bladder. 5. What is cystography? Cystography is the radiography of the bladder. 6. What is diuresis? Diuresis is the amount of urine secreted in 24 hours. 7. What is a diuretic? A diuretic is a substance or medication that increases urine production. 8. What is dysuria? Dysuria is painful or difficult urination. 9. What is enuresis? Enuresis is often the urinary nocturnal incontinence in children. 10. What is urinary urgency? Urinary urgency is a form of incontinence that is characterized by the urge to urinate immediately, without being able to wait. Part 4. 1. What is nocturia? Nocturia is when there is urination several times at night. 2. What is oligonuria? Oligonuria is a decrease in the amount of urine produced. 3. What is polychuria? Polychuria is urination more frequent than normal and often in small quantities. 4. What is polydipsia? Polydipsia is excessive thirst. 5. What is polyuria? Polyuria is an increase in the amount of urine produced. 6. What is pyelonephritis? Pyelonephritis is an infectious inflammation of the renal pelvis and tubules. 7. What is the height of the kidney? The height of the kidney is 12 centimeters. 8. What is the width of the kidney? The width of the kidney is 6 centimeters. 9. What is the thickness of the kidney? The thickness of the kidney is 3 centimeters. 10. What is the weight of the kidney? The weight of the kidney is approximately 150 grams. 11. What is the weight of a perfused kidney? The weight of the perfused kidney is about 1,500 grams. Part 5. 1. The kidneys are in what kind of position in the body? The kidneys are in a retroperitoneal position. 2. The kidneys are located between which vertebrae? The kidneys are located between the vertebrae T12 and L03. 3. Which of the kidneys is lower? The right kidney is lower than the left kidney. 4. And why is this kidney lower? The right kidney is lower than the left kidney in order to adapt to the liver. 5. What is the fibrous capsule surrounding the kidney? The fibrous capsule surrounding the kidney is the renal capsule. 6. What is the blood filtration unit? The nephron is the blood filtration unit. 7. A kidney contains how many nephrons? A kidney contains about 1 million nephrons. 8. What does the nephron comprise of? The nephron comprises of a renal tubule and a collecting tubule. 9. What is the interface between the blood and the urinary system? The renal corpuscle is the interface between the blood and the urinary system. 10. What are the parts of the renal tubule? The parts of the renal tubule are the proximal tubule, the loop of Henle, and the distal tubule. Part 6. 1. Why is it that women should avoid wiping from back to front after defecation? Women must avoid wiping from the back to the front after defecation because the female urethra is very short, and its orifice is close to the anus, and fecal bacteria can easily access it. 2. Why is it that women who have active sex lives have the most urinary tract infections? This is the case because sexual intercourse pushes bacteria from the vagina and external genital organs to the bladder. 3. What is the size of the urethra in a man? The size of the urethra in a man is 20 centimeters. 4. What is the size of the urethra in a woman? The size of the urethra in a woman is 3 to 4 centimeters. 5. What happens to the internal sphincter at the time of ejaculation in a man? The internal sphincter at the time of ejaculation in a man contracts. 6. What can happen if this internal sphincter is damaged? It can cause male infertility. 7. What is the function of the hormone EPO, erythropoietin? The production of new red blood cells. 8. Why is it that proteins cannot pass through the primitive urine? Proteins cannot pass through the primitive urine because of their size. 9. What provides energy for active transportation? Mitochondria provides energy for active transportation. 10. Which cells touch on a large surface? Epithelial cells. 11. What determines the magnitude of the concentration gradient? The length of the loop of Henle. Part 7. 1. Which organs fight against acidification? The lungs, the kidneys, and the liver. 2. Where are prostaglandins derived? Prostaglandins are derived from cholesterol. 3. What permits the innervation of the kidney? The renal plexus. 4. Is glomerular filtration an active or a passive process? Glomerular filtration is a passive process. 5. What triggers the urination reflex? The urination reflex is triggered by mechanoreceptors and spinal nerves. 6. Kidneys are responsible for how many % of the cardiac output? Kidneys are responsible for 25% of the cardiac output. 7. Where is vitamin D activated? In the kidneys. 8. Why is active vitamin D given to someone with kidney problems? Someone is given active vitamin D in this case, because the person is no longer able to activate vitamin D in the liver. 9. What does it mean that the urine is sterile? This means that it does not contain any bacteria. 10. What is the normal pH of urine? The normal pH of urine is about 6. 11. Does vegetarianism make urine acid or alkaline? Vegetarianism makes urine alkaline. Part 8. 1. Does vomiting make urine acid or alkaline? Vomiting makes urine alkaline. 2. What is urine composed of? Urine is composed of 95% of water and 5% of solute. 3. What does the solute of urine contain? The solute of urine contains uric acid, creatinine, and urea. 4. Is urine more acidic or more alkaline at fasting? Urine is more acidic at fasting. 5. Does urine density decrease during fever? No, urine density does not decrease during fever, it increases. 6. Does urine density decrease during the consumption of an excessive amount of fluids? Yes, urine density decreases during the consumption of an excessive amount of fluids. 7. Why is glucose normally absent from urine? Glucose is normally absent from urine because it is completely reabsorbed by the tubular cells. 8. Why is albumin normally absent from urine? Albumin is normally absent from urine because it does not pass through the glomerular filter. 9. What are the mechanisms of urine formation? The mechanisms of urine formation are filtration, reabsorption, and secretion. 10. What can cause urinary retention in older men? The increase in the size of the prostate, and the loss of the bladder tone. Part 9. 1. What is the glomerular filtration rate, GFR formula? GFR equals diuresis times the concentration of the vesicular urine, divided by 1440 times the blood concentration. 2. What is the relationship between diuresis and age? Diuresis decreases with age. 3. What do a yellow and a very pale urine color indicate? A yellow and a very pale urine indicates a low urine concentration. 4. What does foamy urine indicate? A foamy urine indicates the presence of proteins in the urine. 5. What does urine with an unpleasant odor indicate? Urine with an unpleasant odor indicates the consumption of certain foods in the urine. 6. What does a fruity smell of urine indicate? A fruity smell of urine indicates the presence of ketone bodies in the urine. 7. What is the cause of glucose in urine? The cause of glucose in urine is hyperglycemia. 8. What is the cause of the presence of conjugated bilirubin? The cause of the presence of conjugated bilirubin is caused by jaundice. 9. What is the cause of ketone bodies in urine? The presence of ketone bodies is caused by insufficient calories intake and increased energy expenditure. 10. What is the cause of the presence of blood in urine? The presence of blood in urine is caused by urinary tract bleeding, urinary tract infection, incompatible transfusion or kidney trauma. 11. What is the cause of the presence of urobilinogen in urine? The presence of urobilinogen in urine may be caused by liver failure. Part 10. 1. What causes the presence of nitrites in the urine? The presence of nitrites in the urine may be caused by a bacterial infection, often of fecal origin. 2. What is the cause of the presence of leukocytes in the urine? The presence of leukocytes in the urine may be caused by a urinary tract infection. 3. What hormone helps us to conserve water when we are dehydrated? ADH, the antidiuretic hormone. 4. What is the origin of the antidiuretic hormone? The neurohypophysis. 5. Which hormone controls the equilibrium of potassium and sodium? The aldosterone hormone. 6. What is the cardiac output of the renal circulation at rest? 1.2 liters per minute. 7. What is the helium of the kidney composed of? The helium of the kidney is composed of the renal artery and the renal vein. 8. The fibrous capsule is rich in? The fibrous capsule is rich in collagen. 9. The fibrous capsule is poor in? The fibrous capsule is poor in fiber. 10. What are the endocrine functions of the kidneys? The endocrine functions of the kidneys are renin production, the production of erythropoietin, and the activation of vitamin D to active calcitriol. 11. What is the link between blood oxygenation and erythrocyte production? The link is that erythropoietin increases its production of erythrocytes when there is a decrease in blood oxygenation. Part 11. 1. Where does the blood of the afferent arteriole come from? The blood of the afferent arteriole comes from the renal artery. 2. Where does the blood of the efferent arteriole go? The blood of the efferent arteriole goes to the renal vein. 3. What is the interface between the cardiovascular system and the urinary system? The glomerulus. 4. What are the roles of podocytes? Podocytes ensure the filtration of blood plasma through the pedicels. 5. What are pedicels? Pedicels are ramifications of the podocytes. 6. What is the function of the renal glomerulus? The function of the renal glomerulus is the formation of primary urine and blood filtration. 7. What is another name for the renal glomerulus? The corpuscle of Malpighi is another name for the renal glomerulus. 8. What permits urine formation? The nephron. 9. What is the other name of the glomerular capsule? The Bowman's capsule is the other name of the glomerular capsule. 10. Where does the first stage of blood filtration take place? The first stage of blood filtration takes place in the glomerular capsule. 11. What are the two layers of the Bowman's capsule? The two layers of the Bowman's capsule are the parietal and the visceral layers. Part 12. 1. What is the function of the basal lamina? The basal lamina allows the diffusion of nutrients. 2. What is the glomerular hydrostatic pressure? The glomerular hydrostatic pressure is the force exerted by the blood on the glomerular membrane. 3. Does hydrostatic pressure favor or oppose filtration? Hydrostatic pressure favors filtration. 4. What is the sign of the glomerular hydrostatic pressure? The sign of the glomerular hydrostatic pressure is positive. 5. What is the capsular hydrostatic pressure? The capsular hydrostatic pressure is the force exerted by the filtrate in the Bowman's capsule. 6. Does the capsular hydrostatic pressure favor or oppose filtration? The capsular hydrostatic pressure opposes filtration. 7. What is the sign of hydrostatic capsular pressure? The sign of hydrostatic capsular pressure is negative. 8. What is the primary urine level per day? The primary urine level per day is 180 liters in 24 hours. 9. Which is more concentrated, the primary urine or the final urine? The final urine is more concentrated. 10. Which pressure retains water in the blood? Osmotic pressure retains water in the blood. 11. Which is more voluminous, primary urine or ultrafilter primary urine? Primary urine is more voluminous. Part 13. 1. What is the particularity of the collecting tubule? The collecting tubule can be permeable or impermeable to water. 2. What is the function of the ANP, atrial natriuretic peptide hormone? The ANP raises the blood pressure. 3. Is the ANP a polypeptide hormone? Yes, the ANP is a polypeptide hormone. 4. Where is the ANP synthesized? The ANP is synthesized by the right atrium of the heart. 5. Where do prostaglandins come from? Prostaglandins come from cholesterol. 6. What is the function of prostaglandins? Prostaglandins dilate the vessels. 7. What is the source of metabolism? Metabolism is from an acid source. 8. What are the roles of the kidneys in the acid-base balance? The roles of the kidneys in the acid-base balance is the excretion of ammonium NH4+, the almost complete reabsorption of bicarbonate HCO3, and the excretion of monosodium phosphate sodium dihydrogen phosphate. 9. What is the source of the catabolism of amino acids? It is from an acid source. 10. What is the purpose of the urine test strip? The urine test strip is used to detect urinary tract infections. Part 14. 1. Does the pH of the food eaten influence the pH of the urine? Normally no, the pH of the food eaten does not influence the pH of the urine. 2. In relation to question 1, is there an exception and what is it? Yes, proteins. 3. How much time does the growth of most microorganisms require? Approximately 24 hours and up to 72 h. 4. How is urea formed? Urea is formed by the degradation of amino acids. 5. Where is creatinine in large quantities found? Creatinine in large quantities is found in the skeletal muscle tissue. 6. What is the final product of nucleic acid metabolism? The final product is uric acid. 7. What is the density of pure water? The density of pure water is 1000 kg per cubic meter. 8. What is renal colic? Renal colic consists of pain in the lumbar region that migrates to the bladder and thigh. 9. What is the cause of renal colic? Renal colic is caused by the migration of a foreign body or kidney stones to the bladder. 10. What is renal lithiasis? Renal lithiasis consists of the crystallization of magnesium, calcium and the salts or uric acid contained in the urine. 11. Where are stones formed? Stones are formed in the kidneys. Part 15. 1. What are the symptoms of cystitis? The symptoms of cystitis are polyuria, micturition pain and urge, etc. 2. What is the vesicular murmur? The vesicular murmur is the pulmonary vesicular noise. 3. What is hematuria? Hematuria is the presence of blood in the urine. 4. Can kidney stones be eliminated naturally? Yes, kidney stones can be eliminated naturally. 5. What are the 3 major signs of diabetes mellitus? The 3 major signs of diabetes mellitus are polydipsia, polyuria and polyphagia. 6. What is dipsomania? Dipsomania is a disease that gives the need and the desire to drink excessively. 7. Is insulin necessary for the entry of glucose into the liver? No, insulin is not necessary for the entry of glucose into the liver. 8. Is the concentration of glucose in the glomerular filtrate the same as in the blood? Yes, the concentration of glucose in the glomerular filtrate is the same as in the blood. 9. What is volemia? Volemia is the total volume of blood. 10. What is orthostatic hypotension? Orthostatic hypotension is the fall of the systolic blood pressure when standing. 11. What is the most important electrolyte in the treatment of diabetic acidosis? Potassium. Part 16. 1. What is depletion? Depletion is a decrease in the amount of fluid. 2. What is turgescence? Turgescence is the ability of the skin to return to its place quickly, when it is released. 3. What does turgescence show? Turgescence shows the elasticity of the skin. 4. What does a weak turgor show? A weak turgor may indicate extreme weight loss or often dehydration. 5. What releases the internal sphincter during urination? An involuntary medullary reflex. 6. What authorizes or represses the relaxation of the external sphincter of the urethra? The brain. 7. What supplies energy for active transportation? The mitochondria. 8. What is the function of the ureters? The ureters lead the urine from the kidneys to the bladder. 9. What is the function of the bladder? The bladder is a reservoir where urine is temporally stored. 10. What is the function of the urethra? The urethra leads the urine from the bladder to the outside of the body. 11. What compresses the right kidney? The liver. Part 17. 1. The helium leads to a cavity called the renal sinus. 2. What is special about the adrenal gland at the functional level? The adrenal gland is part of the endocrine system. 3. What is nephrotosis? Nephrotosis is the descent of the kidneys or kidney. 4. What can cause nephrotosis? Rapid weight loss in a very short time. 5. What is the other name for the renal pelvis? The pelvis of the kidney. 6. What is pyelitis? Pyelitis is an infection of the renal pelvis and calyces. 7. What is called the whole kidney infection? Pyelonephritis. 8. What is hydronephrosis? Hydronephrosis is the obstruction of the ureter that can cause the urine to flow back. 9. Is glomerular filtration an active or passive process? Glomerular filtration is a passive process. 10. Is inulin produced by the body? No, inulin is not produced by the body. 11. Is the urine composition changed when the urine begins to flow into the ureters? No. Part 18. 1. What happens to the size of the kidneys with age? The kidneys shrink with age. 2. What are the three envelopes surrounding the kidneys? The three envelopes surrounding the kidneys are the fibrous capsule, the adipose capsule, and the renal fascia. 3. What keeps the kidneys in their normal positions? The adipose capsule. 4. What is renal infarction? Renal infarction is an obstruction of an interlobular artery of the kidney. 5. What is nephrolysin? Nephrolysin consists of substances, heavy metal, etc., toxic to the kidneys. 6. What is the action that pushes urine? Peristalsis. 7. What is the region of the kidney that contains the largest number of nephrons? The renal cortex. 8. What gives the urine its normal color? The urochrome. 9. What is another name for the urochrome? Urobilin. 10. Why does the newborn infant often urinate? The newborn infant often urinates because his or her bladder is small. Part 19. 1. Is the hilum part of the structure of the nephron? No, the hilum is not part of the structure of the nephron. 2. What does the urine of a person who has a lot of sweat contain in large quantities? Mineral salts. 3. What does the urine of a person who has a lot of sweat contain in small quantities? Water. 4. Do the kidneys ensure blood pressure? Yes, the kidneys ensure blood pressure. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding the urinary system of the human body.